move into our program for today, one of my first interactions with Lieutenant Governor Brian Calley was when he was actually a state representative. And as a pharmacist by training and representing pharmacists, I do spend some time on the legislative side. And my very first interaction with him was responding to an email of one of my members who was disgruntled at the time. And you'll remember Shane, and we'll leave it just as Shane. Shane sent an email that was very explicit, inappropriate, going to a state representative. And I immediately moved into kind of a damage control of questioning, why would you send him an email that calls him all these names and certain things? And that all worked out all well. And my member is kind of the old Wild West type, you know, the draw, aim, and shoot. Well, his approach is draw, shoot, then aim. And so it was a situation that it still happens, unfortunately. So hopefully Shane hasn't communicated to you quite like that here recently. But during that whole process, Brian was very genuine, responded a nasty email right back to him, which surprised me a little bit, but very appropriate, and through all of that. One of the things that's probably most important about Lieutenant Governor Calley is that he's really committed to trying to remove barriers. Both he and I had children who spent time in the hospital. And I guess the best way to put it, it was serious illnesses, serious situations. The best way to put it is that there are lots of opportunities for improvement. And I know that that's one of the things that drives me to try to improve the situation for at least one person in the future. But he's really committed to trying to remove some of those personal barriers that are within state government, within the other activities and things in Michigan. And he really does truly care for the people of Michigan in trying to improve things. He's gained some national recognition for his work in the area of mental wellness. He led our activities here in the state related to autism insurance, and he's really traveled throughout the state really promoting all of that. He served 2 terms in the Michigan House of Representatives, and his career in community banking provided him the background for which he's doing today. And he continues to be the key person in the governor's, or one of the key people in the governor's team, dealing with his legislative experience and working with the legislature. Lieutenant Governor Calley holds degrees from Michigan State University, Grand Valley State University, and Harvard. He and his wife, Julie, live in Ionia County with their 3 children. Now, unlike Tim Pletcher, who yesterday in the introduction of our Nick Lyon identified MiHIN as a springboard for greatness, that got me thinking a little bit. And I think I have one of those springboards also, in that the night before Brian was named Lieutenant Governor, he and I spent some time in a parking lot in Eaton Rapids. So who knows? If you talk to me, you might have a chance in politics. So with that, Lieutenant Governor Brian Calley.
Thank you. So spending time with somebody in a parking lot that deals with drugs, I don't want that taken out of context. Well, thank you for the invitation to be back again this year. I always feel like in crowds and audiences like this, with the details of how things work, you know so much more than I do. I wanted to share with you though some of the why. So the what and the how are things that we've been working toward over the course of the last few years. But I wanted to try and reset the why we're doing this type of work and why it matters so much, and what type of a difference that it can make. You know, we have had quite an exciting last 4.5 years. There's so many things that have happened. But one of the most important things, and one of the things I'm most excited about, is the ability that we have today to really spend most of our time building the type of future that we want, because so many of the crises of the past have been truly put behind us. And so fiscal crisis in the state of Michigan, or at least within the government of the state of Michigan, it really is behind us. We had yesterday, in a very almost boring set of votes, the budget passed. Now, just a few years ago, when I was in the State House of Representatives, 2007, my first year, there was a government shutdown. You might remember this. In 2009, there was another government shutdown. In 2010, when the budget got done a few hours early, literally just a few hours before the start of the next fiscal year, people were like high-fiving about that. And so now it's 4 months early is the new on time. And so this has given us to take so much of the crisis management off the table and to focus on the future has given us an opportunity to do so much more. And so I wanted to talk about what some of the visions are, and even some of the discussion maybe you've heard, and some of the things that you're seeing happen within state government today, and what that is about and how that relates to the type of work that you do. So if you were to look in our two of our biggest departments, which are the Department of Human, well, it's now we put them together, but why did we put them together? Human Services and Community Health. So these are two of our biggest areas in state government. But what we find is that the populations that we're trying to help in those areas are very, they overlap substantially. So two groups of people that are substantially the same, that are served in very different ways. In fact, we had literally dozens of different programs, and they're social programs that were meant to help people to not necessarily solve problems, but at least to sustain or meet basic necessities of life in really tough times. The problem is that none of it was really connected, or not connected in a functional way. Certainly not between the two departments, but even programs within the departments. And what we find is that within government, funding streams tend to dictate the actions and the way that we deliver services. That's how it has been for so long. But that creates, it naturally has created silos and different groups of people that work on problems and work on issues that in the system didn't lend itself very well to people working together. When we had put those two departments together, the idea was not just administrative savings. We'll have some administrative savings, I think, but that's not the purpose of it. It's not even close to the main purpose of what we're trying to accomplish there. What we want to do is to create a government that meets the needs of people and addresses root problems where people are and in ways that are relevant to their lives, as opposed to expecting people to conform to the artificial constructions of government programs. And this has really been a barrier in a lot of different ways to helping people to get back into the mainstream. Now, if you think back in January when the governor gave the State of the State address, he called it the river of opportunity. I wanted to develop that a little bit more in terms of what he was talking about. If you think about our social programs today, they basically sustain people where they are. So somebody has gotten sidetracked in life. They've gotten kind of pushed off to the side. Something went wrong, and they need help getting by. Our government programs today, for the most part, sustain somebody where they're at. What we want to do is to transform it into a system that helps move people back into the mainstream, that helps to move people more toward independence, to get at the root cause of the problem. So part of it might be food stamps is what somebody needs to sustain at a particular period of time. But why is it that this family or this individual is in a position to need that type of help? To really understand the why behind their current station in life. And then to develop around that the person-centered plan to move them back toward independence. And there's a whole bunch of different answers. We can't come up with a quote-unquote program to address this type of a challenge, because the things that get somebody sidetracked in life, they're so varied, there's so many different possibilities. But we've tried this on a smaller scale over the course of the last few years. We're really ready now to scale it up. But over the course of the last few years, something you may have never heard about, I wanted to zero in just as an example. It's a little bit different because it's not, it includes some health care, but it's not really a health care issue, but the philosophy is the same. Within the Michigan Economic Development Corporation, we have something called Community Ventures. I don't know if anybody in here has ever heard of Community Ventures. It's a relatively small-scale program where we try to help 1,000 people that are structurally unemployed. Structurally unemployed means been out of a job for a very long time, maybe never had a job. So the sort of person that just, it doesn't matter whether you have good economic times or bad economic times. You notice when they say full employment, you know, that means 4% unemployment, right? So we're talking about the group of people that has been unemployed for a very long time, structurally unemployed for whatever reason. No matter how good the economy gets, this is a group of people that can't seem to hold down a job or secure employment. So we built a capacity, relationships with some socially minded employers that are willing to give somebody a shot, and also to identify people who want to work, who say they want to work, but have never been able to nail that down, and then do an evaluation. What is stopping this individual from gaining and securing employment? And then whatever the answer is, there's not a predetermined, here's what the program we give you, or here's what we do to help. We first determine what is the problem, what is the root problem, and it could be a whole bunch of different things. By the way, transportation ends up being the most common problem. It kind of breaks my heart because that's such a solvable problem. But about half of people don't have reliable transportation to hold down a job. That in this structurally unemployed group of people that we've worked with so far. So over the course of the last 3 years, 3,000 people have secured employment, and it might be mental health services, it might be transportation, it might be job training, it might be housing. Who knows? Whatever the problem is, whatever the thing is that a person needs, that's what we do. Our attitude is whatever it takes to help this person solve the root problem, connect them to opportunity, and then see how, and then support them through that and see how they do. Here's what we found out, was that when you deal with the root problem, when we actually start with what is the problem and then build the services around the person, we hear back from these employers that the retention rate after a year is superior to the general population that they normally hire from. And so we're really excited about now this is just 1,000 people per year. But as we look at ways to scale this up and to apply it to everything that we do in government, to get away from the prescriptive attitude of we're going to set up a program first and try and fit people into that program, and instead say, start with the person with a meaningful evaluation of what they need, and then provide the relevant services and support them in moving them toward independence. And it really, and I'm going to oversimplify it here, but it gives us, you know, our metrics, it makes it a lot simpler, because the metric that we care about, are we moving people toward independence or not? Are they more independent or less independent than they were before? And we know that if we are moving people toward more independence, more self-determination, more of a self-determined life, then we're making progress. That's what the merger of this department really is about, is the creation of this department, the merger of the other two. But it can't just stop there. So the work with the sharing of information is so critical to this being successful. That the idea that we are able to use information that we have and to receive that information in a way that is both shareable and in a form that can be analyzed in a meaningful way, that is what is going to give us the ability to make the smart decisions in how we help people in the future. Now, within state government, you'll see in this year's budget and over the course of the last few, you'll see that we're doing this type of work and making these investments now. It was a lot harder sell in 2011 when we had a huge budget deficit to deal with, to make the types of investments in upgrading our capacity and technology, both the physical infrastructure and the training and the resources behind our people. And we did have a long way to go. In fact, there's this, sometimes I use this joke. I don't actually know what it means, but people like you usually laugh at it, so I'll share it with you. The governor has this thing, you know, when we talk about we need to upgrade technology, he'll say, you know, if you know COBOL, we got a place for you at the state of Michigan. And I mean, I guess that's a little before my time, but we still have systems that run on that thing, whatever that is. And so it's but it shows you, I mean, we have a lot of work to do, but those investments are being made every single day. And so as we start to take these steps, I'm so excited about what the potential is for us to make to make some meaningful steps toward transforming the service delivery that we have in a way that doesn't just sustain people sidetracked in life, but we make smart decisions and provide relevant, effective services that help to move people toward independence. And if we're successful in doing that, I don't think that there's any, I don't think that we can really predict or overstate how important that is. When we start making those generational type improvements for the future. And that's really that's the bigger picture, the why behind all the work that is happening right now and trying to make sure that our people that need information to make the best decisions have that information in a format that is helpful to them. And not, we want to get away from the busy work aspect of things. And sometimes I look through our, our annual financial reports, and I see all the different things that are measured and reported in there, and some of them are helpful and some of them aren't. And at the end of the day, we don't just want information, but we want useful information at the right time and at the right place and in the right language and the right format that is useful for people that need it to make decisions and to build the best and most effective services around our people. Now, Larry had mentioned even just having a child. Actually, I have 2 children with very special challenges, and one of them in the physical health care, one with a neurological difference. And so with the physical health care system, it's there is, we have the best, I'm convinced, we have the best healthcare system anywhere in the world in terms of at least what is really available to our people is pretty amazing. And the healthcare, on the mental health care side, it's a little different there. It is disconnected from the rest of the healthcare system in most places. And there have been, I know a few examples of places where it's really been put together. But as one of the areas, if I could ask for some particular focus on, would be to really think toward how do we better connect the health care from the neck up to the health care from the neck down. I can tell you with very extensive experiences in both places that the health care system from the neck down is way better. It is way better than the health care system from the neck up, and it's just because it's so disconnected, and there's so many barriers to finding your way to the right place, and so having that better connected and having that work in a more seamless fashion, I think would go a long way, particularly when you consider that people with serious mental illness literally live lives that are decades shorter, literally decades shorter on average than people without those neurological differences. And so this is a challenge. And by the way, there is no other place where that would ever be accepted. Right? There was no other classification of people that we would ever say that is acceptable for. And yet with neurological differences for some reason, but if you look at the whole system, it is so segregated from everything else that it's not surprising that it has dramatically different types of results. And by the way, and I don't mean to say anything negative about the people that are working in that system. I think there are tremendous barriers to success in there, some of which are societal. They don't even have to do with it's the stigma of people even accessing mental health care. But the more that we do to integrate that and to look at it as one healthcare system instead of the physical healthcare system and the mental health care system, the more that we do to integrate that together, I think the more barriers that you break down and people that are willing to go and seek the health care. And if you think about that, I mean, the way that it's set up today, you know, you have even the physical plant, the way that it works, is usually there's this place, you go down to the place that deals with neurological differences. It's usually set aside, or even different buildings, or totally, it feels very segregated, and that just reinforces the stigma. Now, these are big long-term issues, but as you think about putting the systems together in a way that allows for healthcare to be coordinated across the entire body instead of just separating the brain out from everything else, as those systems get put together, I want you to think about the actual physical layout of the healthcare delivery as well, because that makes a really big difference in not just the way that the service is provided, but the willingness of people to try and go and access the service in the first place. The last thing I'll share before I finish up is there's a pilot that is happening I'm pretty excited about, which it's a state-federal partnership that we're trying. We're calling it the No Wrong Door policy. And it's particularly in our mental health area with our soldiers that are coming back from really hard fighting and that are facing tremendous challenges and very serious barriers to accessing treatment or receiving treatment, just because, I mean, the military culture doesn't lend itself very well to saying that I have a problem, particularly with PTSD. But we know that these injuries or these effects of service are real, even when we can't see them, and even when there's an effort to try and keep them hidden. And so, what we were concerned about, is some of the feedback we were getting, was that even when somebody says, "I want to get help," that so often, you know, they'll knock on a door, and somebody will say, "Oh, thank you for your service." You're actually not at the right place, though, because you served at this time, or you served in this way, and so you're supposed to go over here to this place. And so they would go to that place, if they even get that far. Thank you for your service. You know, actually, you're not in the right place. You're supposed to be over. And so there's this kind of like handoff type of a situation, not even really a handoff, but a push-off. And so what we're doing in 2 different regions of our state in partnership with VAs and then our state-based system is to say no wrong door, that no matter where somebody goes, the answer is you're in the right place. You're in the right place. The backroom operations of how to work out the funding streams and to find the permanent home for that person, that's the responsibility of whatever person makes that first contact. Now, you can imagine that there's a lot of connections that are going to be required in order to make this work and work really well. The good news is that we have willing partners in these particular regions, both at the federal and the state level, and I'm really excited about what it could mean as we start really building what we do around what our people need in a way that is relevant to them and effective for them, and in the place where they are, what type of difference that this could make. It could really be transformational for service delivery in government and make us more effective than we've ever been in the past. So for your part in that and your willingness to serve in this way, I want to say thank you. I want to thank you for your diligence. And I know that as we get a couple years into this, sometimes the excitement or the energy starts to trail off. But I know with this, particularly with just the enrollment and attendance, that it seems to be building. And that's exactly what we need. There's so many different people that need to be on board and on the same page and working on these issues in order for us to be as effective as we possibly can be. And so you being here, I think, is a signal that you're committed to that, and that it's building, and it will be that definition of what happens in the future. So all the best, and thank you so much, and please have a successful rest of your conference.